What if GERD test results are normal but symptoms remains? Imagine going through all the tests for acid reflux and getting results that say everything looks fine, yet your symptoms are still bothering you. That can be confusing and frustrating, but it's actually quite common. When tests like pH monitoring or impedance testing come back normal, it means that the typical acid reflux isn't showing up as the cause of your discomfort. But your symptoms are still there, so what's really going on? First, it's important to know that symptoms like heartburn and regurgitation can sometimes be caused by other issues besides acid reflux. For example, reflux hypersensitivity is a condition where the esophagus is overly sensitive to normal amounts of reflux that aren't harmful. You might feel symptoms even when tests don't show abnormal reflux. Then there's functional heartburn, where symptoms happen without any abnormal reflux at all. These conditions can mimic GERD but don't show up on standard tests. Another possibility is nonacid reflux. This happens when stomach contents that aren't strongly acidic still come back up and cause irritation. Standard pH tests mainly detect acid, so they might miss nonacid reflux. Specialized tests like impedance monitoring can help identify this type of reflux. Persistent symptoms despite normal test results could also be linked to other esophageal conditions. For instance, esophageal motility disorders affect how the esophagus moves food down. Eosinophilic esophagitis, an allergic inflammation of the esophagus, can cause similar symptoms and might need biopsies to diagnose. Psychological factors like anxiety can also make you more aware of or amplify your symptoms, even if reflux isn't the cause. It's also worth checking if you're taking your medications correctly. If you're prescribed proton pump inhibitors, taking them at the right time and dosage is key. Incorrect use can lead to ongoing symptoms even if tests are normal. If your tests are normal but symptoms persist, don't worry. Your healthcare provider might suggest other treatments like pain modulators, which can help reduce esophageal sensitivity. Lifestyle changes are still very helpful. Elevating the head of your bed, avoiding meals close to bedtime, and cutting back on foods that trigger reflux can make a difference. Sometimes, further testing such as endoscopy or biopsies might be needed to rule out other conditions. These tests can look for inflammation, structural issues, or allergic reactions. Remember, having normal test results generally means your condition isn't dangerous, but managing symptoms is still important. In the end, ongoing communication with a healthcare provider who specializes in digestive health is the best way to find relief. They can help you understand what's causing your symptoms and develop a plan tailored to your needs. Living with symptoms that don't match test results can be challenging, but with the right approach, you can find ways to feel better and improve your quality of life.